Hello, I'm Dr. Gil Wilshire at Missouri Fertility in Columbia, Missouri. Today we're going to be talking about birth control pills and fertility. I get so many questions about birth control pills. Women, their husbands, boyfriends, everyone is worried. Gee, I took birth control pills for a year or 5 years or 10 years, and did I damage my fertility? Did I hurt myself? And it's a very common question, even though there's no basis in reality. So let's talk about this situation. First of all, women are born with a certain number of eggs. And every day during reproductive years, these little what I call baby eggs or primordial follicles, they wake up, smell the coffee, and if the situation isn't perfect, they die. So eggs are waking up and dying every day, no matter what. Whether you're on birth control pills or not, whether you're pregnant or not, being treated for other conditions, eggs are waking up and dying every day. Birth control pills have nothing to do with this process and do not damage your pool or reserve of eggs. Second, birth control pills have multiple medical benefits. Obviously, they greatly prevent pregnancy. They're not perfect, but they're awfully good. Pregnancies end in miscarriage. Sometimes pregnancies are ectopic. Sometimes pregnancies are undesired. All these pregnancies, or a vast majority of these pregnancies, are prevented by birth control pills, obviously. So these have beneficial effects on the reproductive system. Birth control pills also have a number of long-term health benefits. Birth control pills lower the risk of uterine cancer. They lower the risk of ovarian cancer. They're probably neutral when it comes to breast cancer and other conditions. And if a woman is normal weight and doesn't smoke, should not affect her risk of heart disease either. So the long-term safety of birth control pills is very well established. Another common question is, gee, I've been on the pill for a few years. Do I need to be off the pill for a while? 3 months, 6 months, a year? Do I need to be off the pills for an extended amount of time before we attempt pregnancy? And the answer to this is a distinct, definite no. We use birth control pills before fertility treatment cycles all the time. They keep cysts from growing. They may suppress endometriosis. We can use birth control pills right up until we start fertility treatments. So you need to realize in 2 or 3 days after the last birth control pill is taken, these hormones are generally excreted, they're peed out, they are gone, and the normal hormone systems called axes, they all come back to life. So you do not have to take a long time off for birth control pills. 2 or 3 days is all that is required. Do not be wasting time letting it get out of your system. There's no point in doing that. So, in summary, birth control pills are very, very safe. They're the most studied medication in history, in fact, and some would advocate that they're safe enough to be over the counter. So please do not fear health problems from birth control pills. They're very effective. They help the skin. They help cycle control. I could go on and on about the multiple benefits of pills. So if you're not ready to have kids or you have medical problems, pain, heavy periods, endometriosis, all these things, take your birth control pills without fear of it affecting your future fertility. I hope this is helpful to you. This is Dr. Gil Wilshire of Missouri Fertility.